Minnesota Department of Human Services. How to complete a Minnesota healthcare program's renewal for people who are age 65 or older and people who are blind or have a disability. Are you age 65 or older? Are you blind? Do you have a disability? Did you answer yes to any of these questions, and are you receiving medical assistance from the state of Minnesota? If so, then you are required to complete a renewal for your healthcare benefits each year. The renewal notice is sent to you and other enrollees through the U.S. Postal Service. Households may receive more than one renewal notice during the year, depending on the household's program eligibility. There are two types of renewal notices you could receive. Each type requires a different action for you to take. Let's look at each of the notices so you can determine the right action to take. The first type of notice is the Healthcare Notice of Action. If you receive a Healthcare Notice of Action, it means your coverage has been renewed automatically using the information that the agency knows about the people in your household. You can tell if you received a Healthcare Notice of Action by looking at the notice you received. The last page of the Healthcare Notice of Action will list the person, the program that has been automatically renewed for that person, and which type of income that person has. If the information is correct, you do not need to do anything more. If any of the information on the notice is incorrect, contact the agency worker listed on your Healthcare Notice of Action. The second type of renewal notice is the It's Time to Renew Your Benefits notice. It will come with a Minnesota Healthcare Program's renewal form. It looks different than the Healthcare Notice of Action, and it has additional requirements and a timeline for returning the renewal. If you receive an It's Time to Renew Your Benefits notice and a Minnesota Healthcare Program's renewal form, you must answer all the questions and fill in all the required information on the form promptly. Next, you will find the front page of the Minnesota Healthcare Program's renewal form. It tells you why you received the renewal form and provides a list of what you need to do with the form. It also tells you to review and complete all the questions that apply to you. You may need to attach copies of proofs for the information you list. It states that you must send the most recent copies of proofs. If you do not have copies of proofs available, return the form before the deadline anyway. Next, it tells you to sign and date the renewal form. Be sure to read the Notice of Privacy Practices and the Notice of Rights and Responsibilities. Keep them for your records. The next step is to mail, fax, or take the renewal form and proofs to the servicing agency. You can also visit mn.gov/DHS/renew-my-coverage to find out about other ways you can submit your renewal. The next section tells you where you can get help with this form or who you can call if you have questions. Last, it explains that if you do not return the form, your coverage will end. It is important to remember that if you return the Minnesota Healthcare Program's renewal unsigned or with incomplete information, we will have to follow up before completing your renewal, and your eligibility for coverage may end. If your renewal is returned late, your coverage will end. Here are a few tips to help you complete your Minnesota Healthcare Program's renewal form. Please note that there are different renewal forms that are sent to people who are age 65 or older or people who are blind or have a disability, depending on the household member's program eligibility. This presentation will demonstrate how to complete the DHS 3418 renewal form. The other renewals have the same general content, so you can use this information to complete the renewal form that you received. Towards the top of the first page of the renewal form, it reminds you to answer the questions the best you can, to return the form and proofs right away, and to call your agency worker if you have questions. For question 1 of the renewal form, fill in your contact information. For question 2, answer if anyone in your family is an American Indian or Alaska Native. If you answer yes, you will need to complete Appendix A. For question 3, list all other people living with you. This includes your spouse, parents, guardians of children under 21, step-parents, children, and stepchildren living in your home. Also include people who are living away from home for a short time. If you need to request coverage for someone who is not currently enrolled in a Minnesota healthcare program or need to add a new household member, answer yes for question 4. Follow the instructions to add the person's information or call your county agency to add them. For question 5, indicate if anyone living with you was in foster care in any state. If you answer yes, you will need to fill in the information for that person. There are several questions about different sources of household income over the next few pages. Please complete these questions carefully. Accurate income information is vital to getting the correct healthcare eligibility. Question 6 asks, is anyone self-employed or expect to be self-employed next month? If your answer is yes, fill in the information about self-employment for that person. You must provide proof of this income. If there is not enough space to answer questions or fill in information for all people, make copies of the page or write the question number and answers on a separate piece of paper. Return the additional pages with the renewal form. Question 7 asks, is anyone working or does anyone expect to work in the next month? If your answer is yes, fill in the information about that person's job. You must provide proof of the income. Completely fill out all boxes for all jobs worked by household members, including the employer information, wages, and tips. There is space to list 2 jobs. If this is not enough space to answer questions or fill in information for all people, make copies of the page or write the question number and answer on a separate piece of paper. Return the additional pages with the renewal form. Question 8 asks, did anyone get money this month or does anyone expect to get money next month from sources other than work? These sources include Social Security, Supplemental Security Income, SSI, retirement, or pension payments, payments from a contract for deed, child or spousal support, workers' compensation, public assistance payments, annuities, unemployment, veterans benefits, rental income, interest, dividends, trusts, or any other payments. If your answer is yes, fill in the name of the person, the type of income, the amount received, how often it is received, and if this income has ended. You must provide proof of this income. Again, there is space to list this type of income for 2 household members. If you need more space to answer, make copies of the page or write the question number and answer on a separate piece of paper. Return the additional pages with the renewal form. Question 9 asks, is anyone in the household blind, or does anyone have a disability? If the answer is yes, list the household member and their work expenses if they have any. You must provide proof of these work expenses. There are several questions about different types and sources of household assets over the next few pages. Please complete these questions carefully. Accurate asset information is vital to getting the correct healthcare eligibility. Please fill out these questions completely and send in the most recent proofs available. If you tell us about your assets and provide proofs that show that your assets are above the limit, we may be able to tell you how much you must reduce your assets before your next annual renewal to ensure you keep your coverage. Moving past the asset questions to question 21, the renewal asks you to tell us about changes in health insurance during the last year, such as changes to coverage through an employer, changes in health plan costs, and the loss or gain of coverage, including long-term care coverage. List who the change is for, what changed, and the date of the change. Question 22 asks you to tell us about any changes that happened during the past year. These changes include pregnancy, marital status, student status, disability, Medicare coverage, someone moving out of the household, or immigration. Select all that apply and complete the requested information. Complete questions 23 and 24 if you are pregnant, if you are a parent or caretaker relative of a child under age 21 who lives with you, or if you are a child under age 21, unless you're enrolling for MA under the TEFRA option. Question 25 asks if we can contact you by email or text message. Select yes or no for each option. If you select yes, provide the phone or email address. Once you have completed the renewal form, you must review the information on the signature page. Then you need to sign and date the renewal, or it will not be complete. The next step is to mail, fax, or take the renewal form and proofs to the servicing agency. We will talk about that shortly. Voter registration information appears on the bottom of this page. If you are eligible to vote, you can register at the website listed. The last step is to return your renewal. Using the envelope provided, put in your completed renewal form, Appendix A, if required, additional copies of pages or extra sheets, and any proofs. Add the necessary postage to the envelope and be sure to address it to the state or local agency shown in the upper left corner of the cover page on the "It's time to renew your benefits" notice. You can also return your renewal form by fax, or you can drop off your completed form at your servicing agency by the date listed. You can also visit mn.gov/dhs/renewmycoverage to find out about other ways you can submit your renewal. In some cases, you may still have one more step to complete. After submitting the renewal form, you may be asked to provide verifications, proof of the information you submitted, or more information. If so, you will receive a request for information. This letter will list the additional information you need to provide to get or keep your health coverage. Be sure to return the requested information by the due date on the request for information. If you don't send the information by the due date listed on the request, your health care coverage will end. After you have submitted your completed renewal form and returned any requested information, you will note your renewal process is complete when you receive a healthcare notice of action. This notice will tell you if each person in your household was approved as eligible for healthcare coverage. You can contact your agency with questions about your renewal if necessary. For more information, go to mn.gov/dhs/renewmycoverage.
Copyright 2024 State of Minnesota, Department of Human Services. Produced by Minnesota Department of Human Services. 444 Lafayette Road, St. Paul, Minnesota 55155. 651-431-2000. Toll free 800-657-3663. Toll free TTY 800-627-3529. Videophone 651-964-1514. Website https://mn.gov/dhs/. The Minnesota Department of Human Services, DHS, prohibits discrimination in its public services because of race, color, creed, religion, political beliefs, national origin, sex, public assistance status, marital status, age, sexual orientation, or disability. Direct discrimination complaints to the DHS Civil Rights Coordinator at dhs.info@state.mn.us or 651-431-2000. Individuals with disabilities may request reasonable modifications to receive DHS services by contacting its Americans with Disabilities Act Coordinator at dhs_ada@state.mn.us or 651-431-3040.